Siti kesayanganku, sungguh banyak jasamu membentuk insan mulia, berilmu berbudaya. Di sini kami sedang berbakti, terus berinovasi. Kami harapkan generasi muda, teras nusa dan bangsa. Bang Siti kesayanganku, sungguh ada jasamu membentuk insan mulia, berilmu berbudaya.
Distinguished guests, ladies and gentlemen, please be seated. Para hadirin dipersilakan duduk. Ilmuwan ini orangnya mesra, menempah kejayaan, kebanggaan negara. Berkumpul kita, saudari-saudara, penuh sabar menantikan beliau berbicara. Salam sejahtera, selamat datang ke Majlis Syarahan Perdana Profesor Dr. Wong pada hari yang berbahagia ini. Para hadirin yang dihormati, izinkan saya untuk meneruskan majlis ini dalam bahasa Inggeris. Ladies and gentlemen, it is indeed my honor to acknowledge the presence of our distinguished guest today. Yang berusaha, Profesor Dr. Zamri Razzi, Deputy Vice Chancellor Student Affairs, University Malaya. Yang berusaha, Profesor Dr. Wong Professor of Behavioral Medicine and Epidemiology, Department of Social and Preventive Medicine, Faculty of Medicine, University Malaya. Yang berbahagia, Profesor Datuk Dr. Yang Faridah Abdul Aziz, Dean, Faculty of Medicine, University Malaya. Members of the Management of Faculty of Medicine and University Malaya Medical Center, Professor Emeritus, Professors, Doctors, distinguished guests, ladies and gentlemen, not forgetting those who are joining us virtually via the Faculty of Medicine YouTube live stream. A warm welcome to each and every one of you. I'm Dr. Catherine Tamari from the Department of Social and Preventive Medicine, and indeed I'm honored to be the Master of Ceremony for today's event. Distinguished guests, ladies and gentlemen, an inaugural lecture is one of University Malaya's distinguished traditions. It marks a significant milestone in the academic journey of a professor and celebrates years of dedication to teaching, research, innovation, and service to the society. Today, we are all gathered here to celebrate this important milestone in honor of Professor Dr. Wong through her inaugural lecture titled Understanding Health Through Behavior and Belief, the Lens of Behavioral Medicine. This occasion is particularly special for me as our speaker today was once my lecturer and is now my esteemed colleague. I've had the privilege of learning from Professor Dr. Wong as her student once. And it is truly humbling and wonderful to now stand alongside her and celebrate this beautiful day with all of you. Ladies and gentlemen, without further ado, I would like to invite Yang Berusaha Professor Dr. Zamri Razzi, Deputy Vice Chancellor, Student Affairs, University Malaya, to chair the lecture and introduce Professor Dr. Wong Please welcome Prof.
Yang juga merupakan mantan pelajar kepada tokoh yang berada di depan kita pada hari ini. Yang berusaha, Profesor Dr. Wong Professor of Behavioral Medicine and Epidemiology, Department of Social and Preventive Medicine, Faculty of Medicine, University Malaya. Yang berusaha dan yang berbahagia, Profesor Datuk Dr. Yang Faridah Abdul Aziz, Dean, Faculty of Medicine, University Malaya. Management of Faculty of Medicine, Professor Dr. Noran Nakiah Hairi, Deputy Dean of Research, Professor Dr. Victor Ho Chiwai Abdullah, Ketua Jabatan, the Head of Department, members of the faculty, dan juga yang kita sentiasa hormati dan sentiasa berada dalam ingatan kita, yang telah menumpahkan demikian banyak jasa kepada kita. Yang berbahagia, Profesor Emeritus, Datuk Dr. Awang Bugilba, yang ada di depan kita pada hari ini. Terima kasih, Datuk. Thank you very much for being here this afternoon. Dan turut meraikan majlis pada hari ini adalah Profesor Dr. Andy Liu Teck Hui, Vice Chancellor, Health University, Malaysia. Thank you very much for coming. Dan barisan orang-orang yang hebat dan terkenal yang ada di depan kita, Profesor Emeritus, Professors, Doctors, distinguished guests, ladies and gentlemen, dan juga keluarga dari Profesor Dr. Wong, Mr. Chai Chen Bu. Shall we give a big round of applause to the beloved husband of Professor Wong, the two Carl and Carla who are here, beloved son and daughter of Prof. Wong, together with Madam Ku Mon Moy and Mr. Gan Sao. Thank you very much for being here. And everyone who are here today, whether physically here or virtually online, thank you very much for joining this. Ladies and gentlemen, it is our honor to introduce Professor Dr. Wong Liping, Faculty of Medicine, University of Malaya, an internationally recognized scholar in behavioral epidemiology and social behavioral medicine. Professor Wong has dedicated more than 2 decades to understanding how human behavior, beliefs, and social contexts influence health outcomes and public health. A graduate of University of Malaya, she obtained her PhD in 2004 and has since established herself as one of the region's leading researchers in behavioral medicine. Her work spans sexual and reproductive health, vaccine confidence and acceptance, infectious diseases, mental health, and other emerging public health challenges. Professor Wong is particularly recognized for her pioneering research on HPV vaccination acceptance, behavior responses during the H1N1 and COVID-19 pandemics, and the role of trust, risk perception, and communication in shaping public health behaviors. Her research continues to bridge behavioral science with biomedical and translational research, strengthening public health responses both nationally and internationally. But beyond these impressive achievements and scholarly contributors, what we find particularly admirable about Professor Wong is a deep commitment to understanding the human being behind the health statistics. She reminds us that medicine is not only about disease, not only about diseases, treatments, and technologies. It is equally about understanding people, their beliefs, their fears, their hopes, and the circumstances that shape the decisions they make about their health. This human-centered perspective is, in many ways, makes her work so meaningful. She brings to her scholarship not only intellectual rigor, but also curiosity, empathy, and a genuine concern for people and society. Ladies and gentlemen, beyond disease-focused research, Professor Wong has made significant contributions to humanistic medical education through Silent Mentor Program at University of Malaya, exploring how empathy, altruism, and professional identity shape the future of healthcare professionals. Ladies and gentlemen, he truly embraced the aspiration of the First Lady to chair University of Malaya. The late Professor Winifred Danaraj, or better known as Winnie, was the first woman to hold this particular chair. And the late Professor the late Professor Winnie, believes that medicine must go beyond treating disease. Doctors must understand the community they serve. Preventive medicine should be integrated into medical education. Public health must respond to the needs of society, and prevention requires people, not just knowledge. She embraced altogether all the aspiration by the beloved wife of the late Professor Danaraj, the founding dean of the top-notch faculty at the time in the region, University of Malaya. Ladies and gentlemen, we believe these aspects of her works tell us much about Professor Wong herself. Her commitment to Silent Mentor program reflects her beliefs that a good doctor, a good person must possess more than scientific knowledge and technical competence. Medicine must also be grounded in compassion, humility, respect, and deep sense of responsibility towards another human being. As someone who had the privilege of seeing the work and contributions of our colleagues within the University of Malaya, I personally greatly value this quality in Professor Wong. She is a scholar who does not simply ask, what do we know? But also ask, what does this knowledge means for people, for our profession, and for our society? And this is a very important distinction. Ladies and gentlemen, she is also someone who demonstrates the academic excellence and humanity can and should go hand in hand. Her scholarship may be highly rigorous and internationally recognized, but at its heart is a simple and profound question: how can we better understand people so that we can better serve them? Her outstanding academic contribution have earned her consistent recognition among the top 2% of scientists worldwide by Stanford University since 2019. Reflecting the global impact on her research and scholarship for university, for all of us, for me in particular. However, while international recognition and academic distinction are important, they are not the only measures of a scholar contributions. The true measure is the knowledge we create, the people we inspire, the students we nurture, and the difference we make to society. In all this respect, Professor Wong has much to be proud of. Ladies and gentlemen, today she will deliver her inaugural lecture entitled Understanding Health Through Behavior and Belief, the Lens of Behavioral Medicine. The title itself captures the essence of her life's work. It invites us to look beyond the disease and to understand the person beyond the clinical outcome, and to understand the behavior and belief that shape it. Ladies and gentlemen, on behalf of the university, we also would like to thank Yang Berbahagia Professor Emeritus Datuk Dr. Awang Bugilba for being here. We really value, Yang Berbahagia Datuk, your presence today. You have supported us, all of us, contributed so much to this university, and he will be very proud of you, Prof. Professor Wong, we are very proud to have you as part of the university family. We look forward to learning from you. Ladies and gentlemen, shall we give a big round of applause to our respected Professor Wong Liping. Over to you, and please allow me to join the rest. Thank you.
Thank you, Yang Berusaha Chairperson, Professor Zamri Razzi, for the kind introduction. Yang Berbahagia Professor Datuk Dr. Yang Farida, Dean of Faculty of Medicine, distinguished guests from the Faculty of Medicine, University Malaya, Professor Emeritus Datuk Dr. Awang Bulgiba, Professor Emeritus Dr. Ku Yiming, and Professor Dr. Sarina Lowayun, distinguished guests from beyond the Faculty of Medicine, Professor Dr. Sazali Abu Bakar, Senior Professor and Founding Director of TIRAC, Datuk Setia Professor Dr. Tan Hui Ming, Adjunct Professor of Surgery, University of Pennsylvania, Professor Andy Liu, Vice Chancellor of Help University, and Venerable Dr. Shi Yu Ting from Humanistic Buddhism Research Center, University Malaya. I'm deeply honored by the presence of all the distinguished guests here today, and to my colleagues, family members, friends, students, ladies and gentlemen, thank you for taking the time to join me this afternoon. It's a great honor for me to be here today and share this important milestone in my research and academic journey. The title of my lecture is Understanding Health Through Behavior and Belief, the Lens of Behavioral Medicine. And I start with the questions, why behavior and belief matter so much in health? The answer lies in the complex nature of health. Health is not determined by biology alone. It is also shaped by people's beliefs, their perceptions, behavior, and the environment in which they live. Another reason behavior and belief matters in health is that biomedical discovery alone may not achieve their full impact. Even when effective health interventions are available, their success ultimately depends on how people respond and behave. For example, vaccines are powerful tools for disease prevention, yet their impact depends on public trust and acceptance. Antibiotics have transformed modern medicine, but misuse has contributed to the growing problem of antimicrobial resistance. Similarly, screening tests for diseases, example pap smear, are effective, but fear, stigma, and low awareness may limit uptake. And even in the era of new medical technologies, health can only be improved if people are willing to use them. Therefore, understanding how people think, feel, and behave is essential. It allows us to bridge the gap between scientific discovery and real-world health improvement. And it is this perspective that has guided my research journey. So, in today's inaugural lecture, I would like to share my research journey and through selected examples, show how behavioral insights can help bridge scientific advances and real-world public health impact. And I will also share my experience collaborating with multidisciplinary teams comprising clinicians, biomedical scientists, pharmacologists, microbiologists, and other healthcare specialists, incorporating behavioral medicine into their respective field. Now, behavioral medicine adopts both quantitative and qualitative approaches, and the field is methodologically diverse. Therefore, I will also share my experience in quanti and quali research methods, which are essential for understanding people's beliefs, experience, and also the social context that shape health behavior. My behavioral medicine research journey began in the field of sexual and reproductive health. I was trained in Malaysia, and I obtained my PhD from University of Malaya in year 2004. And immediately after graduating, I began my academic career by joining Health Research Development Unit, HERDU, which was later renamed to Medical Education and Research Development Unit, or MERDU as we know it today. It was there that my journey in behavioral medicine began. under the mentorship of Professor Sarinalo and also Professor Wong Ling, both pioneer in sexual and reproductive health research in Malaysia. And I'm deeply grateful for their guidance and for involving me in their projects. My first project was a multi-center study of cervical cancer screening involving USM, UM, and UKM. And the UM team was led by Associate Professor Dr. Wong Ling, together with Professor Emeritus Dr. Koo Yee-Ming and Professor Sarinalo. The study used both quantitative and qualitative methods, and the qualitative component was my first exposure to qualitative research, as my background was predominantly quantitative. And through in-depth explorations, unique insight of barriers to cervical cancer screening were uncovered. For example, women illustrated, "I'm afraid of the procedures, that it will be painful and that makes me scared. I feel very shy having to expose myself for the examination." And most importantly, women provided in-depth illustrations such as, "I have many household tasks, cooking and taking care of children. These are more important. Why should I go for a screening? Should I go for screening for a disease that I may not even have? It can wait." And this barrier we later coined as tendency to prioritize family needs over personal health. And it was through this experience that I came to appreciate the unique value of qualitative research method in behavioral research. Beyond identifying what people do, qualitative method reveal why they behave the way they do. And not long after that, I became involved in two major sexual reproductive health projects, one focusing on women's health and the other on men's health. Research on women's health issues was under the mentorship of Professor Sarinalo, together with Professor Halima Awang and Professor Rohana Jani from Faculty of Business and Economics. Men's sexual reproductive health was under the mentorship of Professor Datuk Setia Dr. Tan Hui Ming, Professor Sarinalo, Professor Emeritus Dr. Koo Yee-Ming, and Professor Eun Chik Jen, through the Asian Men's Attitudes to Life Events and Sexuality or MALES project. And through these two studies, I gained hands-on experience in moderating focus group discussion and writing qualitative research papers. To my mentors, I would like to express my heartfelt gratitude for bringing me on board, involving me in your research projects, and giving me the opportunity to learn from all of you. And under your mentorships, my interest in understanding how human behavior influences health gradually evolved into the foundations of my career. Subsequently, I had the opportunity to be involved in a large-scale survey, nationwide survey on HIV/AIDS knowledge, attitudes, and risk behavior among Malaysians. This was my earliest experience conducting quantitative field research. The study was a consultancy project from Health Education Division, Ministry of Health, in the year 2006. And the project was led by Professor Dr. Nasruddin Jaafar from the Department of Community Dentistry, Faculty of Dentistry, and Professor Dr. Sarinalo Wayun as a principal investigator. And I would like also to acknowledge our research assistant, Ms. Caroline Chin, who coordinated the project with great dedication and commitment. Our team traveled to multiple states and districts across Peninsula and East Malaysia to conduct face-to-face interviews. In those days, data did not come easily. Data collection was conducted entirely through face-to-face, paper and pencil interviews. And we did not have online survey panels or electronic data capture systems. What we had was a small team of enumerators carrying stacks of paper questionnaire, traveling to community, from community to reach potential participants. And this photograph shows Ms. Caroline approaching potential participant in a busy market, Our innovator also approached participants in their homes. In some homes, we were warmly welcomed inside. We sat with families, often surrounded by their curious children. However, not every door opened to us. Some interviews had to be conducted at the gate, through the grill, or from the doorway. This project taught me the hardship of field-based data collection. Data collection was limited to location our team could physically access and was easily disrupted by weather and safety concern. And completed questionnaire has to be transported and entered manually into the database. With the budget for over 200,000, we successfully collected just over 1,000 responses, and the study ultimately resulted in just one peer review publication and a conference presentations. And this is the photo of me, Prof. Sarina, Professor Nasruddin and his wife. We attended the 8th International Congress on AIDS in Asia and the Pacific in Colombo, Sri Lanka. Following the success of this nationwide HIV survey, the Health Education Division, Ministry of Health, once again approached Prof. Nasruddin to conduct evaluation of health promotion media campaign 2011. However, this time, the funding was more limited. I think about like just 90K. And reflecting on the challenges we encounter during the previous survey, I began to explore alternative approaches. And I read several overseas nationwide surveys that utilize computer-assisted telephone interviewing, or CATI, for data collection. And I thought this approach would be feasible given that we had limited funding. It was during this period that my research methodology began transitioning into using CATI. CATI is a telephone survey method in which interviewer administer questions using a computer-based system. Telephone numbers are drawn from a directory, and the system will randomly select numbers to call. Questionnaires are displayed on screen. Interviewers read questionnaires from the computer screen and directly key in respondents' answer. And finally, responses are captured directly on the database, and this reduced manual data handling and errors. At that time, I could not find any published studies in Malaysia that had used CATI. There was no one I could turn to for guidance. Nonetheless, we purchased the system from overseas and we implemented it. And I would like to acknowledge Cik Mona Simarani, who was my research assistant for the project at that time. Yeah, she took great initiative in independently studying the instruction and successfully installed the program. But our next challenge was to obtain the electronic directory of the Malaysian telephone number from Telekom Malaysia. Right. Mona went to Telekom and was told that Telekom had never shared its electronic directory. She was told that there are yellow pages, and you can get the number from there. We wonder how we could possibly generate a random sample using printed yellow pages, right? So, and we have to manually enter thousands of telephone numbers into the system. To obtain just 1,000 complete responses, we need to randomly generate and dial 10,000 numbers. Given the response survey generally for telephone survey would have about like 10% of response rate. But we never gave up. Mona returned again, but this time equipped with a support letter from the Dean of Faculty of Medicine, with an ethical approval letter and the evidence of research funding from the Ministry of Health to demonstrate the legitimacy of the project. And we also prepared a detailed letter explaining the importance of CATI and why access to the electronic telephone directory was essential for conducting a proper nationwide survey. Fortunately, we were finally granted access to the Malaysian electronic telephone directory. So, The evaluation of the Health Promotion Media Campaign 2011 became my first study using CATI platform. At that time, this is the most advanced survey method. A bit of introductions about the campaign. In 2011, the Ministry of Health Malaysia launched nationwide media campaigns covering 7 public health topics, namely no smoking, dengue prevention, healthy lifestyle, thalassemia, HPV vaccination, HIV/AIDS, and non-communicable diseases. And our role was to evaluate the effectiveness of these campaigns. And the survey was actually quite simple. For each campaign, we assessed 3 things. Did people notice it, heard, or seen it? Subsequently, did it influence their intention to support or adopt its messages? And third, did they actually put the campaign's recommendation into practice? For example, for healthy lifestyle, 10,000 steps a day campaign. We asked whether they have heard or seen the campaign. If they had, we asked whether they have any intentions to practice 10,000 steps a day. And finally, whether they actually practice it. So 3 simple questions were applied across 7 campaigns. And because the questions were short and straightforward, they were particularly suitable for a telephone-based survey. And we successfully evaluated 7 campaigns and produced a report for Ministry of Health in less than a year. To our best knowledge, that was the first nationwide study in Malaysia that employed computer-assisted telephone interviewing platform. From then on, most of my cross-sectional public surveys were conducted using this method, until we later moved to online surveys distributed through emails, WhatsApp, Facebook, and other digital platforms. Now, I would like to move to the next area of behavioral research, which is HPV vaccination hesitancy. When the HPV vaccine first became available in 2006, it opened up many new opportunities for behavioral research worldwide. Unlike many vaccines, HPV vaccination primarily targets adolescents and required parental consent. And because HPV is sexually transmitted, vaccination also raised important social, cultural, and religious considerations. And I'm grateful to Professor Jamal, who first introduced me to this research area. Shortly afterwards, I successfully secured funding in 2007, which enabled us to conduct one of the earliest studies on HPV vaccination in Malaysia. And a year after that, we published our first paper in 2008. And to our best knowledge, this was one of the earliest publications on HPV vaccine acceptance in the country. And as a young researcher, I was very excited, and I explored HPV vaccination acceptance issues across diverse populations, including parents, young women eligible for HPV vaccination, rural women, university women, right, healthcare providers, and key populations such as MSM as well, and covered a wide range of behavioral issues, including barriers to vaccine acceptance, information needs, influence of religious belief, and cultural sensitivity surrounding vaccinating against an STD, and using both quali and quanti approaches. And of course, the CATI platform that we had developed greatly facilitated many of our public surveys. And in the next 2 to 3 years, we published approximately 14 papers. Many of these papers were published before the introductions of Malaysia's national HPV immunization program for Form 1 girls in year 2010. As HPV vaccinations policy evolved, so did our research. Following the launch of the Malaysian National HPV Immunization Program, we conducted a nationwide study among Form 1 girls from 32 secondary schools across Malaysia to examine whether HPV vaccination was accompanied by adequate health education. And we found that although HPV vaccine uptake exceeded 95%, knowledge about HPV and the need for future cervical cancer screening remained poor among the girls. And only 21.5% of girls reported receiving HPV-related health education along with the vaccines. Our study highlighted an important gap in the implementations of the program at that time. Now, subsequently, following the extension of HPV vaccine recommendation to adult women aged 27 to 45 years, we expanded our research focus to include adult women. And at that time, I thought that would be my last HPV study and that I've covered every aspect. But I was wrong. My HPV research journey was far from over. In July 2016, China approved the HPV vaccine, almost 10 years after it became available in many countries worldwide. And around the same time, our university encouraged international collaboration through overseas adjunct appointment. And I approached Fujian Medical University, China, and was honored to be appointed as an adjunct professor in year 2017. And this gave me an opportunity to extend my HPV research from Malaysia to China. Working with Professor Yulan Lin and Professor Hu Zijian from the School of Public Health, Fujian Medical University, we conducted a series of behavioral studies on HPV vaccination, and to date, we produced over 10 publications, and several of which have been highly cited. My HPV research journey made me realize the big potential of behavioral research. There would always be new questions to explore as health policy evolve, and research opportunity can extend beyond national borders. This was when I knew that behavioral medicine would be the field I want to pursue. Next, my inaugural lecture would not be complete if I did not mention my journey with TIDRAC, or Tropical Infectious Diseases Research and Education Center. Most of TIDRAC research ranges from fundamental science to applied research. And as a behavioral medicine scientist, I found my unique niche within TIDRAC by contributing the behavioral component to their research projects. And over the past decade, I've had the opportunity to take part in several major research grants under the leadership of Professor Sazali Abu Bakar. As well as other numerous smaller scale projects within TIDRAC. In this lecture, I would like to highlight 3 major projects with TIDRAC that have significantly shaped my research journey. First, and I begin with the earliest of all projects, study on dengue virus, which is a flagship initiative funded by MOSTI under Dasar Sains Teknologi and Inovasi Negara Destin. The project title was Development, Evaluation and Integration of Innovative Tools to Reduce Dengue Morbidity and Mortality. Led by Professor Dr. Sazali Abu Bakar, this project comprised of 3 sub-projects. While the other sub-project focused on developing innovative diagnostic tools, my role was to provide behavioral medicine perspective by examining the community factors that determine the successful implementations of dengue prevention interventions. And I had the privilege of leading one of these sub-projects along with Associate Professor Dr. Natasha Lee Hai-Yen. Now, behavioral medicine in this context is important because it helps us understand the link between an effective intervention and real-world impact. This is important because even if an intervention is scientifically effective, it will have limited public health impact if communities do not accept, adopt, and sustain it. So as much as possible, I tried to explore a wide range of behavioral issues related to dengue intervention, acceptance and barriers, using both qualitative and quantitative method. This sub-project produced 4 publications, several of which appeared in high-impact international journals such as PLUS NTD. And I think Professor Zali was very pleased with the outcome. And upon completion, he invited me to continue with another project. The second major project with TICRAC moved from dengue to another mosquito-borne disease, Zika virus. This project was funded under LRGS Mairun program. The title of the project is Mitigating the Potential Health Threat Posed by Zika Virus Infection. The global re-emergence of Zika virus in year 2015 across Americas has prompted WHO to declare Zika a public health emergency of international concern, which initiated the funding of this project by Malaysian government. And similarly, Professor Zali brought together experts from diverse fields to address the threat of Zika virus infection. And there were 5 sub-projects in this study. While the other sub-project investigated Zika seroprevalence, pathogenic mechanism of the virus, immune responses, and also potential therapeutic compound, my role was as principal investigator of sub-project number 1, which focused on the behavioral aspect of Zika virus in prevention. And again, I was paired with Dr. Natasha Lee in this subgroup. This photo was taken during our proposal presentation in November 2016 in Dorset Hotel, Putrajaya. And we got the fund and had our first kick-off meeting in January 2019. It took us 3 years before we get the money. Okay. The photo was taken in Wisma R&D. That time it was still in Wisma R&D. So by that time, Zika was no longer considered a global public health emergency. However, history has shown that infectious diseases re-emerge because people become complacent and abandon preventive measures. So, we focus on studying whether people continue practicing preventive measures after the outbreak was no longer in the public spotlight. Several of our papers bear the title, Has Zika Been Forgotten? Our findings showed that awareness remained high, but preventive practices declined. Once people believed they were no longer at risk, their practices declined. So our behavioral research highlights the importance of encouraging the public to maintain preventive behaviors even after the outbreak has ended. This sub-project produced 6 publications, and likewise, several of which were published in high-impact international journal. And the third one was the more recent project supported by Sukuk Prihatin Stimulus Fund, which is a Malaysian government initiative in response to the COVID-19 pandemic. And this is a very interesting study. Okay. The title of the project is Integrated Approach to Increase the Capacity of Pandemic Preparedness Towards Sustainable Vaccine Development. And again, I work with Dr. Natasha Lee. Okay. This project aimed to strengthen Malaysian local vaccine R&D capacity to ensure timely access to vaccines during future pandemic. One important lesson from COVID-19 pandemic is that we cannot rely solely on external vaccine supply. And during the pandemic, vaccine production was limited, and many countries experienced delay in securing COVID-19 vaccines. And this highlights the importance of building our own vaccine development capacity in Malaysia. Right? However, developing a local vaccine is only the first step. Whether the public willing to receive Malaysian-made vaccine is most important. And this is where behavioral medicine comes in. My role was to examine public confidence in vaccines that are developed by Malaysian scientists, manufactured by local pharmaceutical company, and thirdly, approved by Malaysian regulatory authorities. Now, this was a relatively new perspective. Most vaccine acceptance study focus on the vaccine itself, particularly on safety, efficacy, and also side effect. Instead, our research focused on the confidence of the three stakeholders behind the vaccine, which is the scientists, the manufacturer, and the regulators. For instance, Malaysia and PRA. And to date, this work has resulted in 4 manuscripts, 2 of which were rapidly accepted and published in high-impact international vaccine journal. One is Vaccine Elsevier, and the other one is Journal Vaccine Human Immunotherapeutic, Journal of Human Vaccine Immunotherapeutic. And in addition, Dr. Natasha presented our findings in an international conference last year. And you may ask, why conduct behavioral research at such an early stage, before the vaccine has even been developed? By studying public confidence early, we can better prepare people to accept and to use locally developed vaccine when they become available. Yeah. Closing on NTD chapter, I would like to express my sincere gratitude to Professor Sazali Abu Bakar, Senior Professor and Founding Director of TIDRAC, and the entire TIDRAC team. And especially Professor Dr. Natasha Lee and everyone that I know in TIDRAC. Many of our papers have been published in the top 10 Web of Science Index journal. Thank you very much. More importantly, the opportunity provided by TIDRAC have played a significant role in my growth and maturity as a behavioral researcher. Right. And the experience I gained through my work with TIDRAC also shaped how I approach many of my subsequent interdisciplinary research collaboration. And one example was a project under the impact-oriented interdisciplinary research grant, or IIRG, in collaboration with Professor Dr. Wong from the Department of Pharmacology. Professor Wong's team was developing a novel synotherapeutic therapy, which is an emerging field in geriatric medicines that aim to promote healthy aging by targeting cellular senescence or aging cell. Professor Puifong brought together a multidisciplinary team, Dr. Iskandar and Dr. Lee Yen Ki from Department of Chemistry, Faculty of Science, to work on the design and synthesis of the compound. While Associate Professor Dr. Damani from Pharmacology and Associate Professor Dr. Tamir from Molecular Medicine focused on identifying potential xenotherapeutics for vascular aging. And my role was to lead the behavioral medicine component of the project, and I worked together with Associate Professor Dr. Tan Kit Man. We investigated public acceptance of this new therapy and their willingness to use it if it's become available in the future. We explore stakeholders' perspective on the challenges of introducing this therapy into clinical practice, including healthcare providers' willingness to recommend it and pharmaceutical companies' willingness to invest on its development and commercializations. The behavioral component contributions in this early stage of development is important, as we can address potential barriers early and develop appropriate strategies to support future acceptance of the implementation. And I'm grateful to Professor Wong Puifong for bringing us together and giving us the opportunity to be part of the multidisciplinary projects. Next is pandemic infectious diseases, which became a major turning point in my research journey. My journey into pandemic infectious diseases research began with H1N1 influenza pandemic in the year 2009. In April 2009, H1N1 was first reported in North America, and within weeks, it spread worldwide and became the first influenza pandemic of the 21st century. And I immediately recognized that this is a good opportunity for behavioral medicine research. And even before H1N1 reached Malaysia, I had already started planning behavioral studies. And within a month of the outbreak in North America, H1N1 finally reached Malaysia, with the first confirmed case on 15 May 2009. Ethical approval took some time, and we launched our first H1N1 behavioral survey on 11th of July to 12th September, which is 2 months after the first confirmed case. And once again, Professor Jamal provided invaluable guidance, drawing his expertise in infectious diseases. And during the outbreak, the Ministry of Health released daily updates on number of confirmed cases and death. And this figure were reported extensively every day, in news every day. So what we did was we tracked the psychological and behavioral responses over 10 weeks and plotted them against the daily reported death. And we found that public responses closely mirror the number of deaths. As number of reported death increased, perceived risk and protections behavior increased. When numbers of deaths reduced, these responses also declined. So although H1N1 pandemic was relatively short-lived, but we were able to explore many important behavioral issues during the period. And between 2009 and 2011, we produced 5 publications covering multiple behavioral dimensions of H1N1. And our manuscript received rapid peer review and publication because there was an urgent need for timely evidence to guide risk communication and public health interventions during the pandemic. And this experience actually taught me an important lesson, which is the importance of rapid and timely behavioral research during public health emergencies. Then came the COVID-19 pandemic. The scale and severity of the COVID-19 pandemic created even greater opportunity for behavioral research. And building on my H1N1 experience, I responded much more quickly. And my appointment as an adjunct professor at Fujian Medical University enabled me to initiate behavioral studies at the very early stage of the outbreak, when COVID-19 first emerged in Wuhan. And I would now like to share some of my earliest COVID-19 behavioral studies. When the first case of the novel coronavirus was reported in Wuhan in December 2019, very little was known about the disease. Even its modes of transmission remained unclear, so conventional behavioral KAP studies were not yet feasible. And at that time, COVID-19 was spreading rapidly in Wuhan. And we saw news report of crowded hospitals and growing public panic. Many people were reluctant to visit hospitals because there was so much of uncertainty surrounding the new disease. And we thought we should investigate people in Wuhan's willingness to adopt the recommended preventive measures and seek medical treatment if they develop symptoms, and whether this behavior were influenced by their trust in the government or in the institution. So we launched our online survey on 29th of January 2020, just 1 week after Wuhan entered lockdown. An important finding is that people with greater trust in the authorities were more likely to follow recommended preventive measures and seek medical treatment. And this study highlights the importance of cultivating public trust in institutions of government, particularly during the time of uncertainty and public health crisis. By 24th of February 2020, COVID-19 had already spread beyond Wuhan and Hubei province, and much more were known about the virus. So at this stage, we initiated a conventional behavioral study to assess public's knowledge, attitude, practices, KAP, and psychobehavioral and psychological study. Unlike the earlier study that focused mainly in Wuhan, which this was a large nationwide cross-sectional study involving general public in China. And this study provided one of the earliest comprehensive assessment of both behavioral and mental health responses to COVID-19. And our paper was published in May 2020, which was 3 months after Wuhan entered lockdown. You can imagine how quickly we had to work. We analyzed the data and submitted the manuscript within a week. And the rapid review, acceptance and publications of our paper reflected the importance of behavioral research during public health emergency. And of course, I did not forget about Malaysia. While our collaborative study in China were underway, I was conducting parallel studies to examine behavioral responses in Malaysia. So building on the framework we had established during the H1N1 pandemic, I initiated a 10-week longitudinal psychobehavioral study among Malaysian public. And our study started on the day Malaysia reported its first COVID-19 case, which was on 25th of January 2020. And the study covered both the period before the MCO and during MCO. We can see that the psychological, which is fear and anxiety, psychological responses, and practice of preventive behavior escalate as soon as MCO started. And not long after the implementation of of the MCO, we monitor mental health of Malaysian public as the pandemic progressed during the MCO period. And the study period was between May and September 2020. And we found that depression, anxiety, and stress increased steadily over time, with depression showing the largest rise. And this study provided some of the earliest evidence that mental health burden increased during the MCO as the pandemic progressed. And the finding highlights the need for continuous psychological support during public health crisis. As soon as news emerged that COVID-19 vaccine was under development, I recognized another important research opportunity, which is to investigate COVID-19 vaccine acceptance. We quickly conduct a nationwide survey beginning on 3rd April 2020 to assess the Malaysian public intention to receive a future COVID-19 vaccine and their willingness to pay for it. At that time, it was uncertain whether the vaccine would be available through private sector. And so our findings were intended to inform future vaccine financial strategies. However, Malaysian government provided the vaccines free of charge. But what made this study unique was that it was published in June 2020, 6 months before the first COVID-19 vaccine became available in December 2020. And to our best knowledge, this was the earliest published study on COVID-19 vaccine acceptance globally and became one of my most highly cited COVID-19 publications. Concurrently, I also had the opportunity to work with collaborators from Taiwan, with Professor Ching Ju Chiu from National Cheng Kung University, along with Professor Tony Lee from National Taiwan Normal University. Taiwan was particularly interesting because of its close proximity to mainland China and was one of the first places outside mainland China to report COVID-19 cases. And we also acted very quickly. Together, we conducted 2 nationwide studies during the early phase of the pandemic. One was conducted in February and the other one a month later in March. And we looked at anxiety symptoms and also risk perception and travel restriction. And my COVID-19 research also extended to Middle East, Iran, through Dr. Mahmoud Danai contact. At that time, Iran was one of the countries most severely affected by COVID-19 outside China. And we conducted nationwide study between March and April 2020 to investigate the psychobehavioral implication of COVID-19 in Iran. And my COVID-19 research also extended to Japan through collaboration with Professor Chai Goshi from Nagasaki University. And similarly, we study behavioral responses and anxiety symptoms among general public in Japan. Now, at that time, I also expanded into sero-epidemiological research Beijing Wantai Biology Pharmacy Enterprise is one of China's leading biotechnology company. And during the COVID-19 pandemic, the company played a major role in developing and producing COVID-19 diagnostic test kit and supply large-scale testing effort both in China and internationally. Through our collaboration with Xiamen University and under an MOU signed between UM and Xiamen University, I received COVID-19 antibody test kit from them. And with this test kit, I investigated long-term antibody responses following COVID-19 infection and vaccinations with the help of Professor Chua Kiat Hing and Professor Sazali Abu Bakar. And as the pandemic evolved, I continuously adapted my research to address new behavioral and public health questions across a wide range of topics. And to date, the work resulted in 36 publications, and the majority of these publications were produced during the peak years of the pandemic, which is during 2020 and 2021. And the impact of my COVID-19 research was reflected not only through publication, but also through citation. Many of my publications, especially those published in 2020 and 2021, received rapid international recognition and were widely cited by researchers worldwide. And in 2022, I was honored to receive the Anugerah Cemerlang Universiti Malaya for having the highest number of cited papers under the science category. And a large proportion of this citation came from COVID-19 publication. And this reflects the important role of behavioral medicine during a pandemic. Now, while much of my work has focused on sexual reproductive health, vaccine hesitancy, NTD, and pandemic diseases, I've also involved in numerous small projects across diverse disciplines, and I will highlight some of these projects before I end because they show how behavioral medicine can be applied across many different areas of health research. First, I would like to highlight how behavioral medicine can complement laboratory science using hepatitis E seroepidemiology study. As I mentioned earlier, during the COVID-19 pandemic, we received COVID-19 serological test kit from renowned Beijing Wantai Biology Pharmacy Enterprise. Wantai is also a global leader in hepatitis E diagnosis. In addition to the COVID-19 test kit, we were also provided with HIV ELISA kits. And with this kit, I reached out to colleagues who have readily available blood samples suitable for HIV serological testing. And this effort leads to 3 studies. One study among orang asli community, the second one among blood donors, and the third using archive samples from the Subang Men's Health Study. The first study on indigenous community, was conducted in collaboration with Professor Chua Kiat Hing and Dr. Ki Boon Ping. Prof. Chua had previously conducted a study among orang asli community in Jelebu district and still had blood sample left. So we used the HIV ELISA kit to test on the sample. And our analysis showed an anti-HIV IgG seroprevalence of 5.9%. However, the samples were accompanied by very limited background information, and it's difficult for me to interpret the findings. So I traveled to the orang asli community in Jelebu, where the sample had originally been taken, and I conducted qualitative interview with members of the community to better understanding their lifestyle, their environmental exposure, and potential behavioral risks associated to HIV infection. This study illustrates how serological finding and qualitative behavioral research complement each other. While serology tells us who has been exposed, qualitative research provides an in-depth understanding of why and how exposure occurs. For the second HIV study, through the support of Professor Chua, Dr. Lai Li, I was connected with Dr. Christina Lee from Department of Transfusion Medicine. And using this kit, we screened 500 blood donors for evidence of HIV exposure. and the anti-HEV IgG seroprevalence was 2.8%. Beyond determining seroprevalence, we incorporated questions on behavioral, on environmental, and zoonotic exposure to explore possible risk factors for HEV infections among the blood donors. And we found freshwater recreational exposure and direct rodent contact were strongly associated with HEV seropositivity. And our paper was just published recently in Journal of Transfusion Medicine. And the third HEV study utilized archive samples from the Subang Men's Health Study, a community-based study conducted in Subang Jaya back in year 2006, like 20 years ago. I'm grateful to Professor Datuk Setia Dr. Tan Hui Ming for providing access to these archive serum samples. Although the sample had been stored for nearly 20 years, they had been carefully preserved and remained suitable for serological testing. And we found 11.5% of urban men in the Subang Men's Health Study had evidence of previous HEV infection. One striking finding was that Chinese men had a nearly 27-fold higher likelihood of previous HEV exposure than Malay men. So taken together, these three HEV studies demonstrate that integrating behavioral medicine into serological study help provide a more complete picture of disease risk. So wrapping up my HEV seroprevalence research, I would like to express my sincere gratitude to Professor Chua Kiat Hing and his laboratory for conducting all the serological testing. Next is applying behavioral medicine to improve antibiotic stewardship. This study illustrates that behavioral research is particularly relevant for health problems such as antimicrobial resistance, where human behavior plays an important role in driving the problem. And working with Professor Shashila, we conducted the first nationwide study in Malaysia that comprehensively examined public knowledge, belief, and practices related to antibiotic use in the year 2019. And the study was funded by WHO, and we used our computer-assisted telephone interview platform to conduct the nationwide survey. And our study identified a wide range of inappropriate antibiotic use. Example, people did not adhere to the recommended dosage, reuse leftover antibiotics, obtain antibiotics from pharmacies without a prescription, or even sought another doctors when the first doctors refused to prescribe antibiotics. And Prof. Sashila also highlighted this study in her recent inaugural lecture, and I'm grateful to be part of the work. Okay, next is a very interesting study. My behavioral research extends beyond disease-related to understanding how chronic health conditions affect work performance and economic productivity. One example is our research on migraine in workplace. This was a consultancy project supported by Novartis. Now, migraine is often an under-recognized problem. Many employees do not recognize it as a serious health problem. And those who take leave because of migraine may face stigma or be perceived as using it as an excuse for not coming to work. And working together with Professor Ivy Chung and Professor Nimala, we conducted a study among employees of two major banks in Malaysia, CIMB and Maybank. And we examined the impact of migraine on workplace productivity, measuring absenteeism, presenteeism, and their associated economic costs. This study involved quite a lot of calculations because we had to translate the time and productivity loss due to migraine into monetary costs. An important finding was that the greatest economic loss came not from absenteeism, where a person did not come to work because of migraine, but from presenteeism, where employee who physically present at work getting paid but were unable to perform at their usual capacity because of migraine symptoms. And presenteeism accounted for a loss of about 3,500 per employee per year, compared to only 1,500 for absenteeism. Okay. So our finding was subsequently published in the Web of Science Tier 1 journal. And this study is an example of how behavioral medicine can extend beyond health outcomes to examine productivity and economic impact. And next, behavioral research often uses qualitative method to explore complex experience and perspective. And I would like to highlight an example where qualitative method is used in implementation research. Implementation research is becoming increasingly important in developing an intervention or healthcare problems. It is become increasingly important because developing an intervention or healthcare problems is not enough. We also need to understand how well it works in real-world setting. Prof. Aisha invited me to contribute to her famous Rebung project, where my role was to explore the implementation outcome of diagnostic pathway for breast and colorectal cancer. And together with Prof. Aisha and Professor Hyrene, we conducted FGD with healthcare providers, patients, Rakanku community, navigators, and other stakeholders involved in the Rebung pathway. In the FGD, we explore implementation outcome, namely acceptability, adoptions, appropriateness, feasibility, fidelity, sustainability of the pathway in real-world practice. And qualitative methods are particularly valuable because they can explain why and how implementation succeed or fail. Right? So this project illustrates the important role of qualitative behavioral research in implementation research, and also reinforce that behavioral researchers need a strong skill or expertise in qualitative research. Okay, next is another area where I have applied behavioral medicine, which is digital health. Where in digital health, behavioral medicine can help evaluate whether new health technology are suitable in real-world user before they enter the market. And this was a consultancy project commissioned by Huawei to validate the Huawei Watch D before its introductions into the Malaysian market. The project was led by Dr. Lee Wan Ling, and together with Dr. Lee and Dr. Mahmud Danai, we evaluated the accuracy of the watch in measuring blood pressure in Malaysia multi-ethnic population. And beyond technical validation, we also assessed the performance among individuals with different skin colors and wrist hair densities to ensure that the device performed reliably across Malaysian diverse population. In this study, behavioral medicine plays an important role in bridging technology innovation and real-world adoptions by ensuring that new technologies are suitable for diverse populations who use them. Finally, I would like to share a different dimensions of my behavioral research through Silent Mentor program. Now, the Silent Mentor program is a body donation program where donors became silent teacher, helping medical students learning anatomy, surgical skill, and humanistic values. It all started when Professor Sile approached me, and she mentioned that although the program had been established at University Malaya since 2012, no research has been conducted on its humanistic impact. And she then invited me to join the program and explore potential opportunity for research. Right. I then participated most of the program activities and ceremonies, and not long after that, I became a committee member of the program. And I still remember asking Prof. Soe, the director of the program, whether there's any funding available for me to conduct research within the program. And remember, he smiled and said, everybody in the program serve on voluntary basis. The only paid staff is Mr. Sia, right? The program manager. Inspired by the spirit, I mobilized students to conduct interview with Salamanca's family members. And the family members volunteered their time and openly shared their experience without expecting any form of enumeration. And this has challenged the assumption that research must be grant dependent. So despite absence of funding, we were able to produce 5 publications. And I would like to highlight 2 of these publications because their findings were particularly impactful, and both were published in Web of Science Tier 1 journal under the social sciences category. These 2 studies focus on death anxiety or fear of death, which is common not only among the general public, but also among healthcare professionals and medical students. High level of death anxiety may affect emotional well-being, communication with dying patient, and impact on quality of end-of-life care. We measure death anxiety before and after taking part in the Salamander program, among students as well as family members of the mentors. What we found that participation in the Salamander program significantly reduced death anxiety among both medical students and donors' family members. Witnessing the selfless sacrifice of the Salamander and the experience throughout the program helped them see death not as something to fear, but as a meaningful act of giving. Therefore, the program not only enhances anatomy education, but also supports the emotional preparedness of future healthcare providers in caring for dying patients. It also helps donors' family members to cope with death of their loved one and find meaning in their loved one donation. And the year 2025 was particularly meaningful for our Salamander program research because we received our first research grant from the Fu Gong San Education Center through Humanistic Buddhism Research Center or HBRC. Now, I'm very grateful to Venerable Dr. Shi Ting and Dr. Wong Yi-Tuan from HBRC for their support in getting the grant. Despite the name Humanistic Buddhism, this study is not about promoting a religion. Instead, we use the philosophy framework of Humanistic Buddhism as a framework to understand the values reflected in the Salamander program. Now, some examples of Humanistic Buddhism values are compassion, altruism, gratitude, non-attachment, interconnectedness, and moral responsibilities. These are universal values that many of us practice in our everyday life, regardless of our religion, right? Even though we may not consciously recognize them as a principle of Humanistic Buddhism. For example, when we appreciate what others have done for us, we acknowledge their kindness or contribution, and we express our gratitude through a small gift. We are actually practicing gratitude and merit, which is one of the values of Humanistic Buddhism. So in this study, we use qualitative approach to analyze the reflection that students wrote in the program. For example, medical students describe how selfless sacrifice of the Salamanders inspired them to become more compassionate doctors and more committed to serving their patients. These reflect the value of compassion and altruism in Humanistic Buddhism. Okay. Others recognize that the generosity of the donor can help train future doctors and ultimately benefit many patients and society at large. Okay. These reflect the Humanistic Buddhism principle of interconnectedness, that our actions are interconnected and can create positive effect that ripple across the life of others. Another value of, that emerged from the students' reflection was ethical responsibility. One student recalled what Salamander had said: "Please make mistake on me, but promise me not to make any mistake when you are a doctor." And this left a strong impression on the student, who reflected, "I promise that I will apply the skill and knowledge in my future clinical practice with full responsibility and dedication." And this reflects the humanistic Buddhism value of ethical responsibility, the commitment to practice integrity, responsibility, and high standard of care. So in this study, we analyzed students' reflections to identify the different humanistic values reflected in their experience attending the program. Our study is important because it helps uncover the humanistic learning that students gain from the Salamander program, which may not be captured through the conventional medical education. So for me, this study represents a new dimension of my behavioral research, extending beyond disease-related issues. And it also demonstrates that the behavioral medicine is very versatile and very dynamic. As I conclude this section, I would like to express my heartfelt gratitude to the Salamander program, Professor Soek, former program director, Associate Professor Dr. Liu Yu Tong, current head, Dr. Sakina, deputy head, and also our manager, Mr. Sia. And I would also like to acknowledge our dedicated volunteers and team, Brother Mok, Sister Ong Suvun, Encik Mazlan, and Dr. Tan Sik Lu, whose commitment and support made all our research possible. And I have come to the end of sharing my research journey, and today I'm honored that my research has been recognized by Stanford University and featured in the Elsevier Data Repository as the world's top 2% scientists every year since the list was published in year 2019. However, this achievement is not mine alone. To everyone who has been part of my journey, my mentor, my collaborators, my colleagues, my students, even my research assistants, this recognition may carry my name, but it is your contributions and support that made it possible. And I've done my best to highlight the major milestone of my research journey. However, due to time constraint, it has not been possible for me to mention every project or every individuals who have contributed along the way. In fact, some of the research written in my inaugural lectures manuscript that you received which was prepared earlier, but I could not be presented today. To those whose name or projects that were not mentioned today, please know that this does not mean that your work or contribution are any less significant. Each collaboration has been very meaningful to me, and every one of you has played a part in shaping my research journey. And to young behavioral medicine scientists, I would like to leave you with one message. Research questions will never be exhausted because human behavior is consistently evolving. Even in the era when the world is no longer dominated by pandemic diseases, new health challenges continue to emerge. Wherever there are people, there will be behavior. Wherever there is behavior, there will always be questions waiting to be answered. So, if you choose to pursue behavioral medicine, I hope what I have shared today has assured you that there will never be a shortage of research questions to explore. And now, before I conclude, I would like to acknowledge and thank several individuals and organizations who have supported me throughout my academic and research journey. First and foremost, I would like to express my deepest gratitude to Universiti Malaya, my academic home for many years. Universiti Malaya has provided me with the opportunity, resources, and environment to grow as a researcher and educator. And I'm especially grateful to Faculty of Medicine, which has nurtured and supported my academic journey. Next, to my colleagues and all admin staff in the Department of Social and Preventive Medicine, thank you for being more than just colleagues. You have been collaborators, friends, and an extended family members. We came from different specialty, but we worked together, supporting and complementing one another. And it is this collaboration that makes our work stronger, and I'm grateful to grow together with all of you. Throughout my academic journey, I have been fortunate to receive guidance from outstanding international mentors. And I would like to acknowledge two individuals. First, I would like to acknowledge Professor Emeritus Gregory Zimet. Professor Zimet is a clinical psychologist from Indiana University School of Medicine, United States. And he is one of the pioneers in behavioral research on HPV vaccination acceptance. When HPV vaccine was first introduced in Malaysia, I had no one to guide me, and I wrote an email to Professor Zimet seeking for advice. We have never met in person, but he has supported and mentored my behavioral vaccine research for nearly 20 years. Second mentor, thank you. Second mentor is Professor Zhao Jinjian, a distinguished vaccine scientist with extensive experience in vaccine development. And I first met Prof. Zhao through our collaboration with Xiamen University. Through his support, we obtained HIV and COVID-19 serological test kit from the renowned pharmaceutical company Beijing Wantai Biology Pharmacy Enterprise. Both Prof. Zimet and Prof. Zhao made significant contributions shaping my behavioral vaccine research. And both their names appear on many of my vaccine-related publications. And many of my vaccination papers included discussion on Islamic and religious perspective to better understanding how religious belief, halal concern, and faith-based consideration influence vaccine acceptance among Muslim communities. And I would like to acknowledge Dr. Megat Muhammad Amirul from Department of Primary Care Medicine. Whenever I need his advice on Islamic perspective, he was always the person I turned to. And we have co-authored a series of behavioral vaccines studies, including HPV, COVID-19, and most recently, hypothetical Nipah virus vaccination, incorporating discussion on faith and halal concerns influencing vaccine acceptance. Dr. Amirul is currently away performing Umrah, and unfortunately, he cannot be here. Nevertheless, I would like to express my sincere appreciation to him for his support over these years. Next, I would like to acknowledge my postgraduate student. One aspect of my academic journey that I treasure most is the opportunity to mentor postgraduate students. To my graduate PhD and DRPH student, I'm proud of your achievement. And I would like to highlight that the names in bold are my PhD students from nursing departments, now known as Faculty of Nursing. Many of them were jointly supervised with Professor Dr. Khadijah Lim, Professor Dr. Chong Mei Chan, and Associate Professor Dr. Tan Leong. And to all my PhD and DRPH students, thank you all for allowing me to be part of your academic journey. And I would like to take this opportunity to acknowledge all my colleagues from Faculty of Nursing. Over the years, we have worked together on numerous research projects, postgraduate supervision, and academic activities. It is always rewarding to see former students grow into accomplished academics, researchers, and leaders. And today, we work together as supervisors and students. We work together not as supervisor and student, but as colleagues. Sorry, it's nearing the end. I'm getting tired. So to everyone in Faculty of Nursing, thank you for being such an important part of my academic journey. I am equally grateful to all Masters by Research and Masters of Public Health students whom I have supervised. Although their times with me was shorter, but each journey was equally meaningful. It has been especially rewarding that several of them placed their confidence in me by choosing to continue under my supervision as TRPH candidates, namely Dr. Peter Talk, Dr. Shatesh, Dr. Molly, Dr. Hazira, and Dr. Nur Hidayah. Thank you very much. And to my current ongoing PhD and DRPH student, thank you for entrusting me with the privilege of being part of your academic journey. There are so many of you. I know that there were times that I was overwhelmed with multiple responsibility and could not always give you as much time that I would have liked. For that, I sincerely apologize. And research is never a solo journey. Behind every study conducted, every interview completed, every data set cleaned, analyzed, and every manuscript submitted, stand a dedicated team of research assistants. And you are the backbone of my research. Your hard work and commitment have made all my studies and publication possible over the years. And thank you very much to all my research assistants. Mona, Marina, Nick Norihan, Raja, Nur Amalina, Sharina, and most importantly, Harida, alias. I would especially like to acknowledge Cik Harida alias, who is currently also my PhD student. Harida has worked alongside with me as research assistant for over a decade. And she has been my right hand through numerous research projects. Harida has always been responsible, committed, and always willing to give the extra miles. Thank you, Harida, for your unwavering support until up to today. Thank you so much. And finally, I would like to acknowledge two most important persons in my life, my beloved parents. Unfortunately, they are unable to be here today with me. Yeah. My father passed away just over a year ago, and my mom is not well enough. But I'm very fortunate that I have my mom's sister, Madam Kuman Moy, and her husband, Mr. Gan So, here today, representing my parents. Thank you, Ayi, and thank you, Uncle. Thank you. Both my parents has been the quiet strength behind every step of my journey, and I owe everything I have achieved today to their support. But there is one regret that I still carry with me. My father left us so unexpectedly that I never had a chance to say a final thank you. And with the help of my PhD student, Dr. Yang Xiansu from Kunming, China, a short video was created dedicated to my father. So by the way, Dr. Xiansu just completed her Viva last Friday. Congratulations to her. This video was done with her help. And this video is not a professional production, but it carries every message that I wish I had been able to tell my father in person. And I hope that as this video is played here today, my father can somehow see it, hear it, and know how grateful I am for everything that he has done for me. With that, I come to an end of my inaugural lecture. Thank you very much. Now, can I have the video to be played?
你，世界更美丽。我要谢谢你，因为有你，爱常在。
Thank you very much for attending.
Thank you, Professor Dr. Wong Liping, for sharing your remarkable journey with us. Truly, truly inspiring, Prof. Distinguished guests, ladies and gentlemen, I would like to once again invite Yang Berusaha Professor Dr. Zamri Razzi to summarize and conclude Prof. Wong's inaugural lecture. Dipersilakan, Prof.
Ladies and gentlemen, Professor Wong Liping has spoken. Dr. Catherine, thank you. On behalf of the Faculty of Medicine and University of Malaya, we would like to extend our deepest appreciation to Professor Dr. Wong Liping for a truly insightful and thought-provoking inaugural lecture. Through her lecture, Understanding Health Through Behavior and Belief, the lens of behavioral medicine, Professor Wong has demonstrated that advancing health requires far more than scientific discovery alone. It requires a deep understanding of how people think, feel, behave, and respond to the health challenges that affect individuals and communities. What we found particularly valuable in Professor Wong's lecture is the way she brought together the science and humanity. She has reminded us that behind every statistic is a person. Behind every health decision is a belief. And behind every successful public health intervention is trust. This is a powerful message not only for public health professionals, but also for all of us in healthcare and academia. Ladies and gentlemen, her reflections have highlighted the critical role of behavioral medicine in shaping public health, from strengthening vaccine confidence and improving responses to infectious diseases, to fostering empathy, professionalism, and ethical practice through medical education. Together, these insights remind us that the trust, communication, and human experience are fundamental to achieving meaningful and lasting health outcomes. Professor Wong also reminds us of something that is sometimes overlooked in our pursuit of academic excellence or scientific excellence. Knowledge becomes truly valuable when it changes life. Her scholarship demonstrates how rigorous research, when combined with empathy and a deep understanding of society, can make a real difference to individuals, communities, and the health of nations. The lecture also served as a powerful reminder that the future of healthcare lies in integrating scientific innovation with behavioral understanding, ensuring that research not only advances knowledge, but also translates into real-world impacts for patients, communities, and society. We always remember Yang Berbahagia Professor Emeritus Datuk Awang always remind us every time when we meet, reiterates how important to look at wider perspective, transcend beyond the borders of our disciplines, multi, trans, and cross disciplines. Professor Wong embraced every spirit of that, took the opportunity of that, just like how she took the opportunity to publish the first paper on COVID as vaccines and responses. It is evident from the papers that she published, not the paper within her field of public health She published papers in many other highly regarded journals, publications. Just to name a few, there are many more. Reproductive toxicology, archive of orthopedic and trauma surgery, virus evolution, BMC women health, vaccines, antibiotics, infection and drug resistance, Journal of Cancer Survivorship, oncology practice, oncologists, transboundary and emerging diseases, Frontier in Psychiatry, BMC Psychiatry are those journals, just an example of how wide she published in various other fields. Hence, we saw the names of many, just to name a few. Professor Sazali, Professor Sarina Lau, Professor Ku Imin, Professor Ng Jik Chen, Professor Chua Kek Hen, Professor Shashila, Professor Aisha, Professor Hairin, Professor Soek, Professor Sile, and many more. Ladies and gentlemen, and perhaps this is what makes Professor Wong's contribution particularly significant. She has not only built an impressive body of research, she has helped broaden our understanding of what it means to practice medicines in a complex and changing world. Her work encourages us to look beyond the disease, beyond the numbers, and ultimately to see the person. Ladies and gentlemen, an inaugural lecture is more than a celebration of academic achievement. It is an opportunity for a scholar to pause, reflect on a journey, and share the knowledge and wisdom accumulated along the way. Today, Professor Wong has given us precisely that opportunity. May the insight shared today continue to inspire us to embrace collaboration, strengthen public trust, and advance healthcare in both scientific excellence and deeper understanding of people we serve. Professor Wong, your journey reflects not only academic excellence, but also a deep commitment to humanity, education, and society. University Malaya is very proud of your achievement. Your late father, Wong Mok Lam, must be very proud of you. And your mother, Madam Ku Nyen Mui, must be very proud of you too, who are unable to be here because of health reason. Hence, represented by the auntie, Madam Ku Man Moy, and the uncle, Mr. Gansao. Thank you very much for being here. On behalf of University Malaya, we'd like to thank Mr. Kao Chen Bu. Thank you very much for being a very supportive husband to our very professor. Very proud professor. To Kala and Carl, the lady who stood here at the rostrum just now, before in front of us, is someone who is not only respected at this university, at this country, but beyond. You must be very proud of your mother. And trust us that your mom is very proud of both of you too. Ladies and gentlemen, once again, our heartfelt congratulations to Professor Dr. Wong Liping on this significant academic milestone. May your work continue to inspire others, to mentors, all who supported Prof. Wong Liping. Benih yang ditumbuhkan ini telah pun menjadi pohon. Dan yang pohon ini telah pun menjadi bunga. Dan yang pohon ini telah pun menjadi buah. Yang bunga itu harum baunya. Yang buah itu sedap rasanya. Professor Wong Liping.
Thank you, Yang Berusaha Professor Dr. Zamri Razzi, for chairing today's inaugural lecture. And to our dearest Professor Dr. Wong Liping, may this inaugural lecture mark not only a celebration of all that you have accomplished, but also the beginning of many more exciting chapters ahead of you, Prof. Now, to commemorate today's occasion, may I invite Prof. Zamri and Prof. Wong to join the audience for a group photograph. Dipersilakan, Prof.
And move towards the center. Okay. May everyone stand up? And move toward the center. Belakang tu dapat turun sikit. Okay, everybody. Stand by. Right. Tengok kamera. Ready. 1, 2, 3. Right. Freestyle. Thank you everyone, please.
Distinguished guests, ladies and gentlemen, with that, we bring today's inaugural lecture to a close. Thank you once again for being here with us. For our guests, please join us for refreshments at the center point area. Would like to invite all our guests to the center point area for some refreshments. Thank you once again and have a wonderful day ahead.